Assalamu alaikum, Ultrascan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the posteriors of all four quadrants. Starting with the upper right four, you've got an extremely thin ridge. You've got an approximate crestal ridge of 5 millimeters, mid crest of 4, and a height of 17 millimeters. Moving to the region of the 5, again, very limited bone, just 4 millimeters of bone width, 5 millimeters of height. Moving to the region of the molars, implant placement will not be possible, especially because of the extreme sinusitis here. So sinus cleft procedure would also be complicated. Moving to the upper left four region, we've got again very thick ridge at the crest, approximately 8 millimeters, but mid crest level we've got 4 millimeters and a height of 15 millimeters. Implant placement should be done very mindfully in the region of the 7. Again, no bone, but no sinusitis can be seen. Moving to the lower left 5 region, there we go. So here again we've got extremely thin ridge. Implant placement does not seem to be possible. We've got a ridge width of just 3 millimeters. Moving to the region of the 6, we've got again very thin ridge. If we go deep, approximately 6 millimeters deep, then we will have 5 millimeters of ridge width with 8 millimeters of height. And in the region of the 7, again extremely thin ridge, just 3 millimeters of width with 13 millimeters of height. Moving to the region of the lower right 4, again very thin ridge here as well, 4 millimeters of ridge width with 14 millimeters of height. In the region of the 5, extremely knife edge ridge, just 3 millimeters. And the region of the 6, we've got an extracted socket here, and here also very limited bone, just 3 millimeters of width with 11 millimeters of height. So generally speaking, if we look at the axial view as well, implant placement is going to be extremely difficult, especially to the fact that we've got an extremely thin ridge. This is how thin the ridge is typically at the mandible, and this is how the ridge is of the maxilla, extremely thin and not suitable for implant placement.